Hello everyone. Today we are here to begin with our new video, that is classification of the drugs. This is an important classifications to remember all the drugs, and I try to consolidate all the possible drugs classified as second pro pharmacology books as per KDT's classifications. We have 73 slides and try to revise this classification on the daily basis so that we never forget this classification. So it is an eternal classification. I shall begin with. So now begin with drugs acting on the autonomic nervous systems. These are the cholinergic drugs, um, cholinomimetics or parasympathomimetics. There are two types: cholinergic agonist and anticholinergic. Cholinergic agonists are cholinesters under this acetylcholine, methacholine, carbachol, bethanicol. Alkaloids are muscarine, pilocarpine, ariocholine. In anticholinesterase, there are reversible and irreversible. Reversible are carbamates. Carbamates includes physostigmins, neostigmins, pyridostigmins, edrophonium, rivastigmins, donepezils, and galantamines. And acridine, acridine includes only tacrine. Irreversible, irreversible are carbamates and organophosphates. Carbamates includes sevin, that is carbaryl, and provoxar, this is begon. And organophosphates includes diphos, DFPs, ecothiopate, malathions, diazinon, tabrams, and sevin and sonam. Then we come to anticholinergic drugs. Anticholinergic drugs includes muscarinic antagonist, atropinic drugs, and parasympatholytics. These are natural alkaloids: atropine, hyoscine. Hyoscine is the scopolamine. Semisynthetic derivatives are atropine methonitrate, homatropine, hyoscine butyryl bromide, ipratropium bromide, and diatropium bromide. Synthetic compounds includes antisecretory, antispasmodics, mediatics, varicoselective, and antiparkinsonians. Antisecretory antispasmodic includes quaternary compounds, that is propathelin, oxyphenonium, clindinium, pipenzolate methyl bromide, isopropamide, and glycopyrrolate. And tertiary amines, the tertiary amines includes dicycloamines, valethamate, pyrinosine. Mediatics include only two drugs, that is cyclopentolate and tropicamide. And vesicoselective drugs are oxybutynine, flavoxate, and tolterodine. Anti-Parkinsonian drugs includes trihexyphenidyl, procyclidine, and biperidine. Next, we come to the ganglionic stimulants and block agents. Ganglionic stimulants includes the selective nicotinic agonist. This is nicotine in small doses, lobeline, dimethylphenyl piperazine, DMPP, and tetramethylammonium, TMA, and varenicline. This is selective nicotinic agonist. Then we come to the non-selective or muscarinic agonists. This is acetylcholine, carbachol, pilocarpine, anticholinesterase, MCN 343A. These all are ganglionic stimulants. Then ganglionic blocking agents. These are competitive blockers. Includes quaternary ammonium compounds, hexamethonium, pentolinium, and amines. Amines includes mecamylamine, pempidine, and monosulfonium compounds. These are trimethophan and camphorsulfonate. Persistent depolarizing blockers includes nicotine in large doses, anticholinesterase in large doses. Now we come to the adrenergic drugs. Adrenergic drugs or the sympathomimetic drugs. These are pressure agents, noradrenaline, norepinephrine, ephedrine, dopamine, phenylephrine, methoxamine, and mephenteramine. Cardiac stimulants includes adrenaline, isoprenaline, dobutamine. Bronchodilators includes isoprenaline, salbutamol, tarbutaline, salmeterol, formoterol, bambuterol. Nasal decongestant includes xylometazoline, oxymetazoline, nafazoline, phenylephrine, phenylpropoxamine, phenylpropanolamine, pseudoephedrine. And CNS stimulants includes four drugs. These are amphetamines, dexamphetamines, methamphetamines, methylphenidate. Anorectics includes four drugs also. These are amphetamine, phenfluramine, dexphenfluramine, sibutramine. Uterine relaxants includes four drugs: ditodrine, isosuprene, salbutamol, tarbutaline. Alpha adrenergic blocking drugs. These are non-equilibrium type, that is beta haloalkylamine. This includes phenoxybenzamin. And equilibrium type, these are competitive antagonist, non-selective, alpha 1 selective, and alpha 2 selectives. Non-selectives are ergot alkaloids, ergotamine, and ergotoxin. The hydrogenated ergot alkaloids, these are DHE or dihydroergotamine, dihydroergotoxin, or codargocrine. Imidazole. Imidazoline includes phentolamine, miscellaneous, and miscellaneous is chlorpromazine. And alpha 1 selective agents are prazosin, terazosin, doxazosin, aflatoxin, tamsulosin. And alpha 2 selective includes yohimbine. Next we come to the beta adrenergic blocking drugs. There are also two types of the drugs: non-selective, that is beta 1 and beta 2 blocker, and cardioselective, that is only beta 1 blocker. With non-selective beta blockers without ISA, that is intrinsic sympathomimetic activity, these are propanolol, sotalol, timolol. This includes LOL, LOL groups. And with ISA, this includes pindolol. And with alpha blocking property are labetalol, carvedilol. Labetalol given in the pregnancy related hypertension reactions. Um, Cardioselective beta 1 blockers includes metoprolol, atenolol, acebutolol, bisoprolol, esmolol, betaxolol, celiprolol, and nebivolol. Generation wise classifications, there beta adrenergic blocking drugs are classified into first generations, and that is older and non-selective. These are propanolol, timolol, sotalol, and pindolol. And the selective generations, second generations includes beta 1 or cardioselective drugs. These are metoprolol, atenolol, acebutolol, bisoprolol, esmolol. Third generation drugs with alpha blocking property or vasodilator property. Alpha blocking property also have. These are labetalol, carvedilol, celiprolol, nebivolol, and butaxolol. These are LOL groups drugs. Now we discuss about the topical drugs for the glaucoma. For glaucoma, we use beta-adrenergic blockers. These are timolol, betaxolol, levobutanol, and cartilol. Alpha-adrenergic agonist. This includes dipiveprin, atraclonidine, brimonidine, and prostaglandins analogs. These are latanoprost, travoprost, and bimatoprost. For carbonic anhydrase inhibitors, we use dorzolamide, brinzolamide, and miotics. For miotics, we use pilocarpine, physostigmins, and ecothiopate. For otacoids and related drugs, histaminergic agonists. There are five types of histaminergic agonists. These are non-selective agonists, that is H1, H2, and H3. These are histamine and beta histamine and beta histine. And selective H1 agonists are 2-methylhistamine, 2-pyridyl ethylamine, 2-thiazolyl ethylamine. Selective H2 agonist, these are dimaprid, impromidine, and selective H3 agonist are alpha methylhistamine imitate. Only H1 antagonist, these are conventional antihistaminic drugs. This includes highly sedative property. These are diphenylhydramine, dimethylhydrinate, promethazine, hydroxyzine. And moderately sedative are phenyramine and cyproheptadine, meclozine, and cynarizine. And mildly sedatives are chlorpheniramine, dexchlorpheniramine, and triprolidine, and clemastidine. For second generations non-sedating antihistaminic drugs, we use fexofenadine, loratadine, desloratadine, cetirizine, levocetirizine, azelastine, mesolastine, and ivastine. For 5-hydroxytryptaminase 5-HT antagonists, these are three types: non-selective antagonist and partial agonist or antagonist. These are argotamine, and lysergic acid diethylamide elastine, and 2-bromo-LSD, methyl sargide, cyproheptadine, and cynarizine. 5-HT2 antagonists, these are quintaserine, ritanserine, and clozapine, risperidone. 5-HT3 antagonist includes ondansetron, granisetron, tropisetron, palonosetron, and ramosetron. So this includes citron groups. So now we will discuss about the drugs for migraine to treat the attacks and to prevent the attacks. To treat the attacks, there are just simple analgesics like paracetamol, aspirin, metamizole, codeine. And for NSAIDs, we have ibuprofen, naproxen, diclofenac, and mefenamic acid. For antiemetics, we have metoclopramide, domperidone, prochlorperazine, promethazine, and for ergot alkaloids, we have ergotamine, dihydroergotamine, selective 5-HT ID or 1V agonist. This includes sumatriptans. These are triptan groups drug, rizatriptan, naratriptan, zolmitriptan, provitriptan. And to prevent the attacks, we have propanolol, other beta blockers, amitriptylines, other TCA tricyclic antidepressant, flunarizine, valproic acid, gabapentin, topiramate, cyproheptadine. Prostaglandins. These prostaglandins, natural prostaglandins have, and natural prostaglandins have dinoprostone. These are PGE2, gemiprost, dinoprost, PGF2 alpha, alprostadil, PGE1, prostacyclins, PGI1, epoprostenol, and prostaglandin analog includes carboprost, 15-methyl PGF2 alpha, misoprostolol, methyl PGE1 esters, and latanoprost. This is PGE2 analog, travoprost, and bimatoprost. Now we are here with NSAIDs, that is non-steroidal anti-inflammatory drugs. Non-selective COX inhibitors, preferential COX-2 inhibitors, selective COX-2 inhibitors, and analgesic antipyretics with poor inflammatory actions. So we'll first discuss on non-selective COX inhibitors. This is salicylates, includes aspirin only. Propionic acid derivatives includes ibuprofen, naproxen, ketoprofen, and flurbiprofen. Pheneramides includes mefenamic acids. Enolic acid derivatives includes piroxicam, tenoxicam. Acetic acid derivatives include ketorolac, indomethacins, and nabumetron. Pyrazolone derivatives, this includes phenylbutazone, oxyphenbutazone. Next we come to the preferential COX-2 inhibitors. This includes nimesulide, diclofenac, aceclofenac, meloxicam, etodolac. So on the third group, so we come to the selective COX-2 inhibitors. These are coxibs. These are celecoxibs, etoricoxibs, paracoxibs, and the last category is analgesic antipyretics with poor anti-inflammatory actions. These are para-aminophenol derivatives. This is paracetamol. And its other name is acetaminophen. Pyrazolone derivatives includes metamizole. This is dipyrone and propionazole. And the third category is benzoxazoxine. Benzoxazoxine derivatives. This includes nefovam. Now we discuss about anti-rheumatoid drugs. Anti-rheumatoid drugs include disease-modifying anti-rheumatoid drugs, that is DMRADS, DMRADs. And these are non-biological drugs. Immunosuppressant drugs is methotrexate, azathioprine, cyclosporine, and sulfasalazine, chloroquine, and hydroxychloroquine, and leflunomide. And biological groups agents, these are TNF alpha inhibitors. This is are etanercept, infliximab, adalimumab, interleukin 1 antagonist. This includes anakinra. Adjuvant drugs includes prednisolone and other glucocorticoids. So for the drugs for the gout, acute gout, we use NSAIDs, colchicine, glucocorticosteroids. For chronic gouts or hyperuricemia, we use uricosurics. There are probenecids, sulfenpyrazone, and synthesis inhibitors, that is allopurinol and febuxostat. Drugs for respiratory disorders. For cough, we use these pharyngeal demiculolents. These are lozenges, syrups, glycerin, and leucorize. For expectorants, that is mucokinetics, we have secretion enhancers, that is potassium citrate, potassium iodide, guaifenesin, tolubalsam, Vesica, ammonium chloride. For mucolytics, we have bromhexine, ambroxol, acetylcysteine, carbocysteine. Antitrusive cough center suppressants. For antitrusives, we have opioids, that is codeine, ethyl morphine, pholcodeine. For non-opioids group, we have noscapine, dextromethorphan, chlorpheniramine. For antihistaminics, we have chlorpheniramine, diphenylhydramine, and promethazine. For pulmonary receptors desensitizer, we have prenoxidazine. Adjuvants, antitrusives, these are bronchodilators. This includes salbutamol and tarbutaline. Drugs for bronchial asthma. We use first category, this is bronchodilators. Beta 2 sympathomimetics, we have salbutamol, tarbutaline, bambuterol, salmeterol, formoterol. For methylxanthines, we have threophylline, aminophylline, choline, threophyllinate, and hydroxyethyl threophylline, and doxophylline. And anticholinergics, we have ipratropium bromide and tiotropium bromide. For leukotrienes antagonist, we have montelukast and zafirlukast. For mast cell stabilizer, we have sodium chromoglycate, ketodifan. For corticosteroids, we have two types: systemic, these are hydrocorticosteroids, cortisone, prednisolone, other glucocorticoids. And inhalation have beclomethasone, dipropionate, and budesonide. Fluticasone, propionate, flunisolide, and cyclisonide. Anti-IgE antibody, omalizumab. Hormones and related drugs. Anterior pituitary hormones. These from acidophilic cells, growth hormones GH and prolactin. From basophil cells, we have TSH, thyroid stimulating hormone, ACTH, adrenocorticotropic hormone, and FSH, follicle stimulating hormone, LH, luteinizing hormone. For drugs altering anterior pituitary hormone secretions, we have four groups. First is inhibit GH release, that is somatostatin, octreotide, lanreotide. Inhibit prolactin release. These are bromocriptine, cabergoline, apomorphine. Third group is enhance prolactin release. These are chlorpromazine, other neuroleptics, metoclopramide, and reserpine. Inhibits gonadotropin gene release. These are superactive gene RH agonists. Initially enhances gonadotropin release. Nafarelin, triptorelin, goserelin, leuprolide. Gene RH antagonists are granirelix and cetrorelix. For thyroid hormones, there are two types: T4, that is thyroxine, and T3, this is triiodothyronine or liothyronine. Thyroid inhibitors, we need thyroid inhibitors, inhibit hormone synthesis, that is antithyroid drugs are propylthiouracil, methimazole, and carbimazole. Inhibit iodide trapping, these are ionic inhibitors. Thiocyanates contain SCN, perchlorates, ClO4, anhydrides, NO3. Inhibits hormone release. This is a third group. Iodine, iodides of sodium and potassium, organic iodides. And fourth group is destroy thyroid tissues, that is radioactive iodine, I-131. Insulins. Insulins are of four types: rapid acting insulins, insulin analogs, insulin lispro, insulin aspart, insulin glulicin. Short acting insulins are regular or soluble insulin. Intermediate acting are insulin zinc suspension, that is lentil solution, and neutral protamine HCON, NPH, or isofen insulin, and long acting insulin. Long acting insulin includes insulin analogs, insulin glargine, and insulin detamate. Oral anti-diabetic hormones, so direct drugs. Um, Anti-diabetic drugs includes enhanced insulin secretions, that is K-ATP channel blockers. These are of two groups, that is sulfonylureas and meglitinides, or phenylalanine analogs. Sulfonylureas includes tolbutamide, glibenclamide, glipizides, gliclazide, and glimepiride. And meglitinides or phenylalanine analogs includes repaglinide and nataglinide. Overcome insulin resistance, these are two groups, um, and against one lot remaining, this KATP channel blockers, this enhance insulin. Also another type of drugs, that is the DPP4 inhibitors, dipeptidyl peptidase 4 inhibitors. This also enhances insulin secretions. These are gliptin groups of drugs end with gliptin, that is sitagliptin, vidagliptin, saxagliptin, alogliptin, and linagliptin. In oral anti-diabetic drugs, we have second category drugs. This is overcome insulin resistance. These are biguanides. Only approved drugs is metformin. These are AMPK activators. And we have PPAR gamma activators, that is thiazolidine, and this only drug is pioglitazone. This ends with glitazone group of drug. And last one is miscellaneous drugs. These are newer drugs also. Alpha glucosidase inhibitors, that is acarbose, miglitol, voglibose. Amylin analogs includes pramlintide, and dopamine D2 agonist includes bromocriptine. And sodium co-transporter 2 SGLT2 inhibitors include dapagliflozin. Now we come to corticosteroids. Corticosteroids includes glucocorticosteroids and mineral corticosteroids. Glucosteroids includes short acting, that is hydrocortisone or cortisol. Intermediate acting, that is prednisolones, methyl prednisolones, and triamcinolone, and deflazacort. And long acting includes the dexamethasones and betamethasone. These are also called steroids. And mineralocorticoids includes desoxycorticosterone acetate or DOCA, and fludrocortisone, and aldosterones. Tropical steroids includes tropical steroids. Tropical are potent are beclomethasone disproponate, that is beclomethasone dipropionate, and that is 0.025%. Betamethasone benzolate 0.025%. Betamethasone valerate 0.12%. Halcinoid, and that is 0.1%. Colbetazole propionate 0.05%. Cobetasol, clobetasol, clobetasol propionate, this is 0.05%. Fluocinolone acetonide, that is 0.025%. Flucortitolone 0.5% triamcinolone, it's an acetonide, and this is 0.1%, and dexamethasone sodium phosphate, there is 0.1%. Now we discuss about tropical soil steroids that moderately potent and mild potent. Moderately potent are fluocinolone acetonide and 0.01%, and flucortolone, this is 0.025%. Clobetasol butyrate 0.05%, mometasone is 0.1%, fluticasone propionate is 0.05%, and hydrocortisone acetate is 2.5%. And the mild acting steroids are hydrocortisone acetate 0.1 to 1%, hydrocortisone butyrate 0.001%. Now we discuss about androgens and related drugs. This androgens includes natural and synthetic hormones. Natural androgens are testosterone, dihydrotestosterone, and androsterone. And synthetic includes methyl testosterone, fluxi, fluximesterone, and mesterolone. Anabolic steroids include methandinone, nandrolone phenylpropionate, nandrolone decanolate, oxymethanolone, and stanozolol. Antiandrogens includes cyproterine acetate, flutamide, and bicartamide. 5-alpha reductase inhibitors includes finasteride and dutasteride. Drugs for erectile dysfunctions, androgens are testosterone and others. Phosphodiesterase 5 inhibitors, that is sildenafil and tadalafil and vardelafil. And the intracavernosal vasodilators, that this includes papaverine and phentolamine and L-prostadil PGE1. Estrogens and related drugs includes the estrogens, natural estradiol, estrone, and estriol. Synthetic drugs include steroidal and non-steroidal. Steroidal includes ethinyl estradiol, mestranol, and tibolone. Non-steroidal drugs includes diethyl stilbestrol, hexoestrol, dimensterol. Anti-estrogens includes clomiphene citrate. Selective estrogen receptor down regulators includes fulvestrant. Selective estrogen receptor modulators includes tamoxifen citrate, tormifen, and raloxifene. Aromatase inhibitors includes letrozole, anastrozole, and exemestane. Progestin includes progesterone derivatives. These progesterone derivatives includes medroxyprogesterone acetate, megestrol acetate, dihydrogesterone, hydroxyprogesterone caprate, nobengesterol acetate. 19 non-steroidal derivatives. 19 non-steroidal derivatives includes esterans and gonans. Esterans includes norethindrone, that is norethindrone, line linesterol, that is ethinyl esteranol, allyl esteranol. And gonans includes levonorgestrel, desogestrel, non-gestimate, and gestodin. Antiprogestins includes mifepristone, and selective progesterone receptor modulators includes ulipristal. Hormonal contraceptives. Hormonal contraceptives are of two types. One is oral and second is injectable. Oral is combined pills, includes non-gesterel 0.5 mg and ethinyl estradiol 50 microgram. Levonorgestrel, second combination FTC is levonorgestrel 0.1 to 0.25 milligram plus ethinyl estradiol 22 to 50 microgram. And desogestrel is 0.15 milligram plus ethinyl estradiol 20 to 30 microgram. Phased pills are levonorgestrel fixed dose combination 50 microgram, 75 microgram and 125 microgram plus ethinyl estradiols with 30 microgram, 40 microgram and 30 microgram. Norethindrones includes 0.5 milligram, 0.75 milligram and 1.0 milligram. Ethinyl estradiol along with 35 microgram. Postcoital pill is levonorgestrel in 1.5 mg, levonorgestrel 0.5 mg plus ethinyl estradiol 100 microgram of 2 doses. And another one is progesterone only pills or mini pills. Norethindrone includes 0.35 milligram and norgestrel is 75 microgram. Injectable ones are depot medroxyprogesterone acetate or DMPA, D for depot, M for medroxy, P for progesterone, A for acetate, and norethindrone enanthate. On uterus, we have two actions. We record two actions. One is stimulation actions and one is relaxant actions. Which are stimulants? These are called oxytocin, tosics, and the which relaxes uterus is called tocolytics. So we first discuss on the drugs of oxytocics. The posterior pituitary hormones includes posterior pituitary hormones are oxytocins and desaminoxytocin. The second type is argodalkaloids. Argodalkaloids are argometrin and methyl argometrin. And the third one is prostaglandins, PGs. PGE2 for dinoprostone, PGF2 alpha, dinoprost, and 15 methyl PGF2 alpha, carboprost, and misoprostol plus mifepristone. And miscellaneous drugs will be ethacridine and quinine. About tocolytics drugs, uterine relaxants, these are androgenic agonists, ritodrine, salbutamol, tarbutaline, and isoxsuprine, and calcium channel blockers. Calcium channel blockers includes nifedipine, other dihydropyridines, and oxytocin's antagonist. These are atosiban, and miscellaneous drugs includes magnesium sulfate, progesterone, nitrates, and halothane. Drugs which acts on the peripheral or somatic nervous systems. These are skeletal muscle relaxants. Peripherally acting skeletal muscle relaxants are neuromuscular blocking agents. These are two types, includes non-depolarizing or competitive blockers. These are also long-acting D-tubocurarine, pancuronium, doxycuronium, pipecuronium. Intermediate actings vicuronium, atracurium, cis-atracurium, rocuronium, rapacuronium, and short acting is mivacurium. Non-depolarizing and depolarizing also. Depolarizing blockers are succinylcholine, that is succinylmethonium and decamethonium. In neuromuscular blocking agents, peripherally acting, also we have along with that directly acting agents. These are dantrolene, sodium quinine. And another we have groups, that is centrally acting drugs are uh, mefenacins, conjures, that carisoprodol, chlorzoxazones, chlormazanone, and methocarbamol. Benzodiazepines includes diazepam, and GABA mimetics includes baclofens, and thiocolchicides, and the central acting alpha 2 agonist includes tinidazole. We will done with somatic or nervous system skeletal muscle reactions. Next we come with the local anesthetics. Local anesthetics or LA. This includes injectable anesthetics. Injectable anesthetics are low potency or short duration, procaine, chlorprocaine. Intermediate potency and durations we have lidocaines or lignocaine and prilocaine. With a high potency and long durations we require tetracaine and bupivacaine, ropivacaine, and dibucaine. For surface anesthetics, we have soluble. Soluble, this is cocaine, lidocaine, tetracaine, and proparacaine. Or insoluble, we have benzocaine, butyl aminobenzolate, and an oxythazine. Drugs acting on the central nervous systems, we have general anesthetics or GAs, inhalationals, gas, that is the nitrous oxides, and volatile liquids. Volatile liquids are ethers, halogens, isoflurane, desflurane, sevoflurane. Intravenous drugs, we have fast acting drugs, that is the thiopentone sodium, methohexitone sodium, propofol, and etomidate. For slower acting drugs, we have benzodiazepines, that is diazepam, lorazepam, and midazolam. For dissociative anesthetics, the ketamines, and opioids analgesics, we have fentanyls. For pre-anesthetic medication or drugs, sedatives, anti-anxiety drugs, diazepam, lorazepam, promethazine. Opioids, we have morphine and pethidine. Anticholinergic drugs, atropine, hyoscines, and glycopyrrolates. Neuroleptic drugs, we have chlorpromazines, flupромazines, haloperidol. Gastric acid suppressants, drugs, ranitidine, famotidine, omeprazole, pantoprazole. And antiemetic drugs, metoclopramide, domperidone, and ondansetron. Now we come to the CNS chapter. In CNS, we have sedative hypnotic drugs. Sedative hypnotic drugs includes benzodiazepines, barbiturates, non-benzodiazepines, and other CNS depressants. We first discuss about benzodiazepines. Benzodiazepines includes hypnotics. Hypnotics are diazepam, flurazepam, so all will be end with zepam or zolam or zepam or zolam, diazepam, flurazepam, nitrazepam, alprazolam, temazepam, triazolam. These are hypnotics. Anti-anxiety drugs. Anti-anxiety also zepam or zolam, diazepam, chlordiazepoxide, oxazepam, lorazepam, alprazolam. Anticonvulsants we have diazepam, lorazepam, clonazepam, clobazam. Barbiturates. Barbiturates we have long-acting barbiturates or phenobarbitons. Short-acting barbiturates have butobarbitone and pentobarbitone. Ultra short-acting barbiturates are the thiopentone and methotrexate. Now we discuss about other two groups. These are non-benzodiazepines, zopiclone, S-zopiclone, zolpidem, and zaleplon. Other sinus depressants are chloral hydrates, triclophos, paraldehyde, par, paraldehyde, and glutathione. It's methaqunolone, it's meprobamate, promethazine, chlorpromazine, it's amitriptyline, and morphine. The important anti-epileptic drugs. Barbiturates, phenobarbitons, deoxybarbiturates, primidone, hydantoin. Are phenytoin and fosphenytoin. Immunostilbene. Immunostilbenes includes carbamazepine, oxcarbamazepine, succinimide, ethosuxcinimide, and aliphatic carboxylic acids, valproate acid or valproic acid, valproate sodium, divalproex, benzodiazepines, clonazepams, diazepams, lorazepams, clobazam, and phenyltryazine, lamotrigine, and cyclic GABA analogs, gabapentins, pregabalin. Newer drugs are topiramate, zonisamide, levetiracetam, vigabatrin, and tigabalin, tigabine, and lacosamide. Antiparkinsonian drugs. Antiparkinsonian drugs includes the drugs acting on the brain's dopaminergic systems, dopamine precursors, levodopa, and peripheral decarboxylase inhibitors, that are carbidopa and benserazide. And dopaminergic agonists includes bromocriptine, ropinirole, pramipexole. MAO-B inhibitors includes silazilin, rasasilins, and the COMT inhibitors includes entacapone, tolcapone. Glutamate NMDA receptors agonist or dopamine facilitators includes amantadine. And drugs affecting the brain cholinergic systems are central anticholinergics and antihistaminics. Central anticholinergics are trihexyphenidyl and procyclidine, biperidine, and antihistamines includes orphanadrine and promethazine. Antipsychotic drugs or neuroleptic drugs. These are phenothiazines, includes aliphatic cytosines, chlorpromazine, and trifluoropromazines, piperidine or cytosines, and thioridazine. Piperazine cytosines are trifluoparazines, fluphenazines, and second group is butyrophenes, haloperidols, trifluoperidols, and penfluridol. Thioxanthine includes flupentixol, and other heterocyclic compounds includes pymozide, loxapines. Atypical antipsychotics includes the clozapine, risperidones, olanzapines, quetiapines, aripiprazole, ziprasidone, amisulfides, and zolpidem. Drugs for mania and bipolar disorders. For mania, lithium carbonates, anticonvulsants are the sodium valproates and carbamazepines and lamotrigines. Atypical antipsychotics olanzapines, risperidones, quetiapine, and aripiprazole. For hallucinogens or psychomimetics and psychedelics and psychodysleptics. Indole alkaline amines. This includes lysergic acids and diethylamine LSD, lysergic acids amides, psilocybin, and harmine, and dimethyl tryptamine. Phenylalkyl amines includes mescaline, ecstasy, or methyl dioxy methamphetamine, YABA, methamphetamine plus uh, methylhexamine, and aryl cyclohexylamines. These are phencyclidine. And cannabinoids includes tetrahydrocannabinoids. This is THC. Antidepressants. Antidepressants includes reversible inhibitors of MAO-A, that is moclobemides and chlorothiazide. Tricyclic antidepressants TCS includes NA or 5-HT reuptake inhibitors, imipramine, amitriptyline, trimipramine, doxycycline, dothepin, and clomipramine, and predominantly noradrenaline reuptake inhibitors, desipramine, nortriptyline, amoxapine, and rivoxentin. Selective serotonin reuptake inhibitors or SSRI includes fluoxetine, fluvoxamine, paroxetine, sertraline, citalopram, S-citalopram, daboxetine. Serotonin and noradrenaline reuptake inhibitors SNRIs are venlafaxine, duloxetine. Atypical antidepressants includes trazodone, mianserin, mirtazapine, bupropion, tianeptine, amyneptine, atomoxetine. Anti-anxiety drugs. Anti-anxiety drugs includes benzodiazepines or diazepam, oxazepam, lorazepam, chlorodiazepoxides, alprazolam, azapyronones, that is buspirone, gepirone, and ispapirone. And sedative antihistaminics includes hydroxyzine. Beta adrenergic blockers include propranolol. Opioids analgesics and antagonists. Opioids mu receptor agonists includes natural opium alkaloids, morphine and codeine. Semisynthetic opioids includes diacetyl morphines or heroin, pholcodeine, ethyl morphine. Synthetic opioids are pethidine or meperidine, methadone, fentanyl, dextropropoxifen, and tramadol. Complex action opioids, it's agonist, antagonist, the kappa analgesics, naloxone, pentoxacrine, butorphanol. Partial mu agonist plus kappa antagonist are buprenorphine and pure opioid antagonist. Naloxone and naltrexone and nalmefene. CNS stimulants includes convulsants. Convulsants are strychnine, picrotoxin, bicuculline, pentylentetrazole. Analeptics are doxapram. Psychostimulants includes amphetamines, methylphenidate, atomoxetine, modafinil, armodafinil, pimoline, and cocaine and caffeine. Cognition enhancers includes cerebroselective drugs, which are cholinergic activators, rivastigmine, donepezil, galantamine, tacrin, and glutamate NMDA antagonist are memantine. And miscellaneous drugs include piracetam, pyracetam, pyretinol, dihydroergotaxin, ceticoline, piribedil, ginkgo biloba. Cardiovascular drugs. Antihypertensive drugs. Antihypertensive drugs includes diuretics, thiazides, hydrochlorothiazides, and chlorothalidone, indapamide, high-saline diuretics, furosemide, and others. Potassium-sparing diuretics are spironolactone, eplerenone, amiloride. Renin-angiotensin system inhibitors includes AC inhibitors, includes pril, example sita, captopril, enalapril, lisinopril, perindropril, ramipril, fosinopril, quinapril, trandolapril. The angiotensin 81 receptor blocker includes sartan group, losartan, candesartan, valsartan, telmisartan, irbesartan, olmesartan. Direct renin inhibitors includes aliskiren. Sympathetic inhibitors includes beta adrenergic blockers, propanolol, metoprolol, atenolol, and others. And alpha plus beta adrenergic blockers includes labetalol, carvedilol, and alpha adrenergic blockers includes prazosin, terazosin, doxazosin, phentolamine, phenoxybenzamin. Central sympatholytics includes clonidines and methyl-dopa. Another drugs are calcium channel blockers. Calcium channel blockers includes phenylalkylamine amines, verapamil, benzodiazepines, diltiazem, and dihydropyridines, nifedipine. All is dipine groups. Nifedipine, felodipine, amlodipine, nitrendipine, lacidipine, larcanidipine, benidipine. And vasodilators includes arteriolar dilators includes hydralazine, minoxidil, diazoxides, and arteriolar venodilators includes nitroprusside sodium. Anti-anginal drugs. These drugs includes nitrates, short-acting nitrates, includes glyceryl trinitrate, isosorbate dinitrate, sublingual use only SL. Long-acting drugs includes isosorbate dinitrate oral, isosorbate mononitrate, erythritol tetranitrate, pentaerythritol tetranitrate, and beta blockers includes propanolol, metoprolol, atenolol, etc. Calcium channel blocker includes verapamil, diltiazem, amlodipine, nitrendipine, others, and potassium channel openers includes nicorandil. Others anti-anginal drugs includes trimetazidine, ranolazine, ivabradine, oxyphedrine, and dipyridamole. Dipyridamole. So, drugs for peripheral vascular disease (PVDs) and serological agents are pentoxifylline, vasodilators including direct acting cyclandylate, xanthinol nicotinate, beta adrenergic agonist isoxaprine, alpha adrenergic blockers prazosins, phenoxybenzamines. Calcium channel blockers includes nifedipine, nitrendipine, and prostacyclins BGI2. Phosphodiesterase 3 inhibitors includes cyclostazole. Antiplatelets and drugs includes aspirin, clopidogrel, and ticlopidine. Antioxidant drugs includes vitamin E. Drugs for congestive heart failure. Inotropic drugs including cardiac glycosides, digoxin, oaven, and sympathomimetics including dobutamine and dopamine. PDE3 inhibitors includes enamrenone and milrinone, and renin-angiotensin inhibitors including AC inhibitors, enalapril, ramipril, others, and angiotensin 81 receptor blockers, losartan, candesartan, and others. Diuretics including high-sling diuretics, furosemide, and bumetanide. Thiazide-like diuretics including hydrochlorothiazides, metolazone, zipamide, and vasodilators includes venodilators, glyceryl trinitrate, isosorbate dinitrate. And anterior dilators includes hydralazine, arteriolar plus venodilator, sodium nitroprusside. Beta adrenergic blockers including metoprolol, bisoprolol, nebivolol, and carvedilol. And aldosterone antagonists including spironolactones and eplerenone. Now we discuss about anti-arrhythmic drugs. Class 1 membrane stabilizing agents. A is moderately decrease dV by dt of zero phase, quinidine, procanamide, and dispyramide. B is little decrease in dV by dt of zero phase, lidocaine and mexiletine, and C is markedly decrease in the dB by dt of zero phase, propafenoxone, sorry, propafenone and flecainide. In class 2, anti-adrenergic agents includes propanolol, sotalol, class 3 propadiazole, and ismolol. And class 3 agents widening action potentials includes amiodarone, dronedarone, dofetidine, and ibutidide. And class 4 calcium channel blockers includes verapamil and diltiazem. And drugs for PSVT is adenosine and digoxin. Summarizing the drugs acting on the kidney, diuretics. Diuretics is a high-selling diuretics includes inhibitors of sodium potassium 2 chloride channel. There is a furosemide, bumetanide, toracamide, and medium efficacy inhibitors of the sodium chloride symbiote, benzothiazines, hydrochlorothiazides, hydroflumethiazides, and benzothiazides. Thiazide-like diuretics are chlorthalidone, metolazone, and zipamides, indapamides, and clopamides. Antidiuretic drugs includes antidiuretic hormones and its analogs, vasopressins, desmopressins, libracins, tarlipressins. Natriuretics includes thiazides, amyloride, and miscellaneous carbamazepines, and chloropropamide, and indomethacins. And acting on the kidneys, medium or high efficacy and weak efficacy weak or adjunctive diuretics includes carbonic anhydrase inhibitors, acetylzolamides, and potassium sparing diuretics, aldosterone antagonist, spironolactone and eplerenone, retinal epithelium sodium channels inhibitors, amylorides and triametrine, and osmotic diuretics includes mannitol, isosorbate, and glycerol. Drugs affecting the bloods. This is hematinics includes an iron, oral irons, ferrous sulfates, ferrous fumarate, ferrous gluconate, succinate, ferrous aminoate, ferric ammonium citrate, ferric hydroxypolymaltose, carbonyl iron, and iron calcium complex. Parenteral iron is an iron dextran, iron sorbitol citric acids, ferrous sucrose, and ferric carboxymaltose. Maturation factors is vitamin B12 is cyanocobalamin and hydroxycobalamin and methylcobalamin. And folic acid includes folic acids, leucovorin, and the cytovoram. Factors are adjuvant hematomatics, and copper, pyridoxins, and riboflavin. Coagulants included is used for vitamin K. K is K1 phytonadione or phylloquinone, and K3 is menadione, acetaminophenone, and it's menadione sodium bisulfite or menadione sodium diphosphate. Miscellaneous fibrinogens, humans, antihemophilic factors, desmopressin, and adreno, adrenochrome monosemi-carbazone, and etham silates, and rutin. Pharmacological anticoagulants include parenteral anticoagulants, indirect thrombin inhibitors, heparins, unfractionated low molecular weight heparins, enoxaparins, ribavirin, natroparins, dalteparins, parnaparins, ardaparins, fondaparinux, and danaparoid. Direct thrombin inhibitors includes lepirudine, bifalirudin, and argatroban. And oral anticoagulants include coumarins derivatives, bc-doxycoumarins, warfarin sodium, and acenocomarol, and ethyl biscomacetate. And the direct factor 10A inhibitors includes rivaroxaban. And so oral direct thrombin inhibitors includes dabigatran, in vitro anticoagulants includes heparin, sodium editate, sodium citrate, and sodium oxalate. Fibrinolytics or thrombolytics includes streptokinase, urokinase, alteplase, RPTA, and retiplase, and teneptilase. Antifibrinolytics includes or antithrombolytics includes epsilon aminocaproic acid, EACA, and tranexamic acids. Antiplatelets drugs or antithrombotic drugs includes thromboxane synthesis inhibitors, aspirin, platelet CAMP enhancer, dipyridamole, P2Y receptors blockers, or ticlopidine, clopidogrel, and prasugrel. GP2B3A antagonists include abciximab, eptifibatide, and tirofiban. Hypolipidemic drugs includes HMG-CoA reductase inhibitors, statins, lovastatins, simvastatins, pravastatins, atorvastatins, rosuvastatins, pitavastatins, bile acid sequestrants, cholestyramines, cholestyramine, lipoprotein lipase activators, PPAR alpha activators, fibrates, clofibrates, gemfibrozil, benzofibrates, phenofibrates, lipolysis and triglyceride synthesis inhibitors, nicotinic acids. Steroid absorption inhibitors is ezetimibe. Gastrointestinal drugs for the peptic ulcers, gastric acids secretions inhibitors includes H2 antihistamines, cimetidine, ranitidine, famotidine, and roxatidine. And anticholinergics drugs includes piperazine, propanthelins, oxyphenonium. This includes proton pump inhibitors, omeprazoles, esmoprazoles, pantoprazole, lansoprazole, or includes prazoles groups, and rabeprazoles, dexrabeprazole. And prostaglandins analogs includes misoprostol. Gastric acid neutralizers, that is antacids, include systemic antacids, and that is sodium bicarbonate, sodium citrate, and non-systemic includes magnesium hydroxides, magnesium trisilicate, aluminum hydroxide, megalhadrate, calcium carbonates. And ulcer protectives includes sucralfate, colloid, bismuth, subcitrate CBS. The anti-H. pylori drugs includes amoxicillins, clarithromycins, metronidazoles, tinidazoles, tetracyclines, and CBS. Anti-emetics drugs includes these drugs, anticholinergic drugs, hyoscines, dicyclamines, and antihistaminics includes promethazines, and diphenhydramines, dimenhydrinate, and doxylamine, and meclizines. And neuroleptics includes beta blockers, chlorpromazines, triflupromazines, and prochlorperazines and others. Prokinetic drugs includes metoclopramide, domperidone, cisaprides, mosapride, etoprides. These are prokinetic agents. And 5-HT3 antagonists include ondansetrons, granisetrons, palinosetrons, and ramosetrons. Incumbent receptors antagonist includes apripretent and fosfatripretent, and adjuvant antiemetics includes dexamethasones, benzodiazepines, dronabinizole, and nabilones. Laxatives. These are purgatives or catharatics. These are bulk forming agents, dietary fibers, bran, xylem, or plantago, isofgula, and methyl cellulose. The stool softeners and docusades and DOSs, liquids, paraffin. The stimulant purgatives are diphenyl methanes. These are phenolphthalein, bisacodyl, and sodium picosulfate. Anthraquinolones or imodines. These are Sena, Kesara, Sagradans, and 5-HT4 antagonist, and that includes trucalopride, and fixed oils is castor oil. The osmotic purgatives includes magnesium sulfate, magnesium hydroxide, sodium sulfate, sodium phosphate, sodium potassium tartarate, and lactulose. Drugs for diarrhea. For diarrhea, we use antimicrobial drugs like norfloxacin, ciprofloxacin, rifaximins, clotrimazoles, ampicillins, tetracyclines, erythromycins, and metronidazoles. For non-specific antidiarrheal drugs are non-specific antimicrobial drugs includes absorbents, or adsorbents, isofgula, methyl cellulose, kaolin, and pectin. Antisecretory drugs includes the racecadotril, bismuth subsalicylate, anticholinergics, and octreotide. Antimotility drugs includes codeine and diphenoxylates and loperamide. Probiotics and drugs includes lactobacillus species, Bifidobacterium bifidum, and Streptococcus facialis, Enterococcus species, Bacillus glauci, and Saccharomyces boulardii. Drugs for the inflammatory bowel disease includes 5-ASA compound, that is sulfasalazines, mesalazines, valsalazides, and all salazines. And glucocorticoids includes the prednisolone and hydrocortisones. These are enema, used as enema. And immunosuppressants we use azathioprines, methotrexates, cyclosporins, and infliximabs. Now we start with antibacterial drugs. Antibacterial agents, this includes the inhibits the cell wall synthesis. These are penicillins, cephalosporins, carbapenems, monobactams, vancomycins, cycloserins, and bacitracins. Cause leakage from the cell membrane. This is mechanism based classification. The cause leakage from the cell membrane. These are polymyxins, cholecystins, bacitracin, amphotericin B. Inhibits protein synthesis, tetracyclines, chloramphenicol, erythromycins, others macrolides, clindamycins, and linezolides. Causes the misreading of mRNA to affect permeability, aminoglycosides, streptomycins, gentamicins, and others. Inhibits DNA gyrase, that are ciprofloxacins and other fluoroquinolones. Interfere with the DNA functions, rifampin interferes with intermediately metabolism. This includes sulfonamides, sulfones, and trimethoprim, pyrimethamine, para-aminosalicylic acids, and metronidazole. Sulfonamides. So sulfonamides are classified as short-acting. This is sulfadiazines, intermediate-acting sulfamethoxazoles, long-acting drugs, sulfadoxins, and sulfamethopyrazine. And the special purposes are the sulfacetamide sodiums, the sulfasalazines, sulfasalazines, and mafenite. Quinolones antimicrobials. Antimicrobials includes non-fluorinated quinolones, includes nalidixic acids, and fluoroquinolones includes first generation norfloxacins, ciprofloxacins, ofloxacins, and perfloxacins. Second generation includes levofloxacins, moxifloxacins, gemfloxacins, prufloxacins, lomifloxacins, and sparfloxacins. Penicillins. Penicillins are classified as natural penicillins. Natural penicillins and are benzyl penicillins or penicillin genes. Semisynthetic penicillins include the acid-resistant alternative to the penicillin G. These are phenoxymethyl penicillins or penicillin V. Penicillinase-resistant penicillins are methicillins, cloxacillins, dicloxacillins. And the extended spectrum penicillins includes aminopenicillins, ampicillins, bacampicillins, amoxicillins. And carboxypenicillins includes carbapenicillins, and uridopenicillins includes piperacillins and meslocillins. The beta-lactamase inhibitors includes clavulanic acids and sulbactam and tazobactams. Cephalosporins are of we have 5 generations, but here we discuss 4 generations. First generations are oral cephaloxins, cephadroxils, and parenteral cephazolines. And the second generation drugs are cephalosporin. Cephalosporin groups drugs. Second generation is cefaclor, eudoximic acetyl, and cefprozils. And parenteral drugs includes cefuxims and cefoxitin. Third generation drugs includes oral and parenteral. Oral drugs includes cefixim, cefodoxims, and proxetil, and cefdinit, ceftibutin, and ceftamate pivoxels. And parenteral drugs cefotaxims, ceftriaxone, and ceftriaxoxins, ceftazidime, and cefepime. And four generations includes cefepime and cefpyrone. Anti-tubercular drugs. Anti-tubercular drugs includes first-line drugs isoniazid, rifampicin, pyrazinamide, ethambutol, and streptomycin. Second-line drugs includes fluoroquinolones, ofloxacins, levofloxacins, moxifloxacins, and ciprofloxacins. Other oral drugs includes ethionamide, prothionamide, cycloserines, terizidone, para-aminosalicylic acid or PAS, rifabutin, thiacetazones, and injectable drugs includes kanamycin, amikacin, and capreomycin. Alternative classifications of anti-tubercular drugs. Group 1 or first line oral drugs isoniazid, rifampicin, pyrazinamide, and ethambutol. Group 2 or injectable drugs is streptomycin, kanamycin, amikacin, and capreomycin. Group 3 or fluoroquinolones includes ofloxacins, levofloxacin, moxifloxacin, ciprofloxacin. Group 4 or second line oral drugs includes ethionamide, prothionamide, cycloserines, terizidone, para-aminosalicylic acids. Group 5 or it's unclear efficacy drugs, thiacetazone, clarithromycin, clofazimine, linezolid. Antileprotic drugs. Antileprotic drugs includes sulfone. Sulfone is dapsones, phenazine derivatives. These are clofazimine. It's anti-tubercular drugs, rifampin and ethionamide. Antibiotics, other antibiotics, ofloxacin, moxifloxacin, minocyclines, and clarithromycins. Antifungal, antiviral, and antiprotozoal and antihelminthic drugs. Antifungal drugs includes antibiotics. Example: polyenes. Polyenes includes amphotericins B, nystatins, and hamicins. And echinocardins includes caspofungin, micafungins, anidulafungins. And the heterocyclines benzofurans includes grisofulvins. Tropical antimetabolites and antimetabolites. The second group is after antibiotics. Antibiotic is the first, and the second is antimetabolites is flucytosins, and the third group is azoles. Azoles includes imidazoles. Imidazoles are tropically classified as the include tropical imidazoles are clotrimazole, iconazoles, miconazoles, and oxyconazoles, and systemic are ketoconazoles. Triazoles include some fluconazoles and itraconazoles, horiconazoles, and posaconazoles. Allylamines includes terbinafines. Tropical agents includes tolnafate and desalinic acids, benzoic acids, ciprofloxolamines, bufentafine, and quinidochlor and sodium thiosulfates. Next, we have antiviral drugs. Antiviral drugs are non-retroviral drugs like to combat HIV-like symptoms. The anti-herpes virus drugs, the anti-influenza virus drugs, anti-hepatitis virus drugs, non-selective antiviral drugs. Anti-herpes virus drugs includes hydroxyuridine, trifluridine, acyclovir, valacyclovir, famciclovir, gancyclovir, and valganciclovir, and cytoflovir, and carnet, and formivircin. And influenza virus drugs includes amantadine, the rimantadine, oseltamivir, and zanamivir. Anti-hepatitis virus non-selective antiviral drugs includes for hepatitis B virus lamivudine and adaflovir, dipivoxil, and tenofovir. For hepatitis C includes ribavirin and interferon alpha. We have antiretroviral drugs. These are nucleoside reverse transcriptase inhibitors or NRTI, and we have NNRTI, that is non-nucleoside reverse transcriptase inhibitors. NRTI includes zirovudine, ridanosyne, stravudine, lamivudine, abacavir, emtricitabine, tenofovir. And NNRTI includes nevirapine, efavirenz, dilavirens, dilavirin. Protease inhibitors PIs includes ritonavir, atazanavir, indinavir, nelfinavir, saquinavir, amprinavir, and lopinavir. Entry inhibitor, these are enfuvirtide. CCR5 receptor inhibitors includes maraviroc, and integrase inhibitors are raltegravir. Now we have antiprotozoal anti-malarial drug. Antimalarial drugs includes 4-aminoquinolones. This is chloroquine, amodiaquins, piperaquins, and quinoline is methanol, mefloquine. And cinchona alkaloids includes quinine and quinidine, and biguanides includes proguanil, and diaminopyrimidine includes pyrimethamine, and 8-aminoquinolones includes primaquine and tafenoquine. Sulfonamides, sulfones include sulfadoxins, sulfamethylpyrazines, and dapsons. The antibiotics, doxycycline, clindamycin, and sesquiterpene lactones includes artesunettes, artemether, artether, artarline, and amino alcohols includes halofandrine, lumefantrine, and naphthoquinolones includes atovaquons, naphthyridines, thyridines includes pyronidines. Anti-amoebic drugs includes the tissue amoebics, amoebicides, and the luminal amoebicides, the tissue amoebicides for intestinal and for extraintestinal amoebiasis is nitroimidazoles, metronidazole, citinidazoles, secnidazoles, ornidazoles, and satronidazoles. Alkaloids includes emetine and dehydroemetins, and for the extraintestinal amoebiasis only the chloroquine and luminal amoebicides includes amides. Amides is diloxanide fluorate and nitazoxanides, and 8 and hydroxyquinolones includes quinidochlor and diiodohydroquinone. Antibiotics, tetracyclines, and baromycins. Antihelminthic drugs for roundworm and hookworm and pinworm. Albendazole is used, mebendazole, pyrental pamoate, piperazines, levamisole used. For threadworm, we use ivermectin, ivermectin, albendazoles. For whipworms, Trichinella spiralis, albendazole and mebendazole used. For filariasis, diethyl carbamazine used, ivermectin and albendazole used. For tapeworm, praziquantel, niclosamides and albendazole used. For hydrated disease, albendazole and mebendazole used. Now finally we have anti-cancer drugs, anti-neoplastic drugs, also another name. Anti-cancer drugs are many types. Cytotoxic drugs is the primary one. Cytotoxic drugs includes alkylating agents. Alkylating agents are nitrogen mustards. Nitrogen mustards includes uh, miclorothamine, cyclophosphatamides, and isopamide, and chlorambucil, and milphalan. Ethylenamine, so this includes thiotepa, and alkyl sulfonates includes busulfan. Nitrosoureas includes carmustine and lomustine, and triazines includes and dacarbazines and temozolamides, and methyl hydrazines includes procarbazines. These are alkylating agents. So main alkylating agents are the nitrogen musters, ethylamines, alkyl sulfonates, and nitrosoureas, and triazines and methyl hydrazines. Platinum coordinations complexes includes cisplatins, carboplatins, and oxaliplatins, and antimetabolites includes folate and antagonists. These are methotrexates and pemetrexates. Purine antagonist includes 6-mercaptopurines, 6-thioguanines, azathioprines, fludarabine, and pyrimidines agonist, 5-fluorouracils, and capecitabines, and cytarabines. These are anti-cancer drugs. The cytotoxic drugs continued. Microtubule damaging agents includes vinca alkaloids, vincristins, and so oncovin, vinblastine, and vinorelbine, and taxanins, and paglitaxels, and docetaxels, and estramastines, and topoisomerase 2 inhibitors, etoposide, and topoisomerase 1 inhibitors includes topotectans and irinotectans, and the antibiotics includes actinomycin D, and doxorubicins, and daunorubicins, epirubicins, mitosatron, bleomycins, and mitomycin C. It's miscellaneous drugs includes hydroxyureas, L-asparagines, um, tritione, and arsenic trioxides. Anti-cancer drugs have targeted drugs. Targeted drugs includes tyrosine protein kinase inhibitors, that's imatinib and nilotinib, and the EGF, the receptor inhibitors, and the gefitinib, and ilrotinib, cetuximab, and angiogenesis inhibitors, sunitinib, and bevacizumab, and proteasomes inhibitors, bortezomib, and monoclonal antibodies, rituximab. Hormonal drugs includes glucocorticoids, Glucocorticoids have prednisolone and others. Estrogens have ethinyl and estradiol phosphasterol. ACRM have tamoxifens and doremifen. ACR down regulators, fulvestrant, and aromatase inhibitors have letrozoles, anasterols, and anastrozoles, exemestans, that anti-androgens have glutamate and bicalutamides. 5-alpha reductase inhibitors include finasteride and dutasteride. Gene arrays analogs includes nafarelins and leuprorelins and triptorelins, and progestins includes hydroxyprogesterone acetate and others. Immunosuppressant drugs and the calcineurins inhibitors, cyclosporins, tacrolimus, and mTOR inhibitors, sirolimus, everolimus, that anti-proliferative drugs and azathioprines, methotrexates, and cyclophosphamides, and chlorambucil, and mycophenolate mofetil, and glucocorticoids, prednisone, and others. Biological agents, TNF alpha inhibitors are etanercept, infliximab, and adalimumab. Interleukin 1 receptor antagonist, and anakinra, interleukin 2 receptor antagonist, and daclizumab, basiliximab, anti-CD3 antibody, Simuromab, CD3, and the polyclonal antibody, thymocytes antibody, ETG, the RODI, immunoglobulin. Drugs for the acne vulgaris. So topical drugs have antimicrobials and drugs like benzoyl peroxides, erythromycins, clindamycins, and native-fluoxetines, as fluoxetine, retinoids. It is retinoids, all trans retinoic acids, and adapalene, and tazarotines, as azelaic acids, systemic drugs, antibiotics, and doxycyclines, minocyclines, erythrocyclines, retinoids, isotretinoids, and 13C-retinoic acids. Vaccines are of two types, many types, as kill vaccines, live attenuated vaccines, and toxoid vaccines. Kill vaccines or inactivated vaccines have bacterial vaccines, typhoid, paratyphoid vaccines, TAB vaccines, VI, typhoid, polysaccharide, cholera, whooping cough, pertussis, meningococcal, hemophilia influenza type B, and plague. Viral poliomyelitis inactivated IPV, Salk vaccines, rabies neural tissues, rabies cheek embryo cells, PCEV, rabies human diploid cells, HDCV, rabies vero cells, PVRV, influenza, hepatitis B, and hepatitis A. And live attenuated vaccines are bacterial, bacillus, calmatic urines, BCG, the typhoid, TY21A oral, and some viral poliomyelitis oral vaccines, OPV7, mumps, live attenuated measles, live attenuated and rubella, live attenuated varicella, live attenuated. Toxoid is the tetanus fluid absorbed, diphtheria absorbed, and combined vaccines and double antigens, diphtheria toxoid plus tetanus toxoid, DTDA. Triple antigens, diphtheria toxoid, tetanus toxoids, and pertussis vaccine, DPT vaccines, pentavalent vaccines. Most important is DPT plus hepatitis B plus HIV, that is Haemophilus influenza type B vaccines, measles, mumps, rubella vaccines, MMR vaccines. Okay. Here we end with the slides, and thank you for watching.